All right. Good morning, everybody. Who's ready for lunch? This is what stands between you and lunch, so I'll go quickly. I promised, and everybody did very well sticking to time, so I'll stick to time too. I want to thank Kirby for inviting me back, especially during political season. I think it's very apropos because my 10 minutes are going to be about truth. And so we're not going to talk about whether or not Hillary's a crook or, Cruz is a liar or Trump is whatever. We're just going to do truth as it relates to what we know about the health effects and what we don't know. And a lot of this really is about what we don't know or what we're currently in the process of discovering. And so our role at the health department really as educators, as an organization that's responsible for surveillance, really, in the regulatory scheme of things, is not to have an opinion or create policy, but to actually provide information as a result. And so sometimes we have to correct perceptions. Sometimes we come up with our own. And so I'm going to give you a little bit of a potpourri here, mostly as it relates to air. I think when you're talking about oil and gas operations, as you all know, folks are concerned about the ground, they're concerned about the water, they're concerned about the air. And as a result of being concerned about those things, then what's the impact on people's health? And so I don't really have the time, nor do we have the information as it relates to ground or water, so we get a pass on those today. So we're gonna concentrate mostly on air. So with that, we'll start with methane because last year, or actually now 2 years, since our rulemaking as it related to methane emissions. And so I'm going to keep asking the group a test question because you don't get lunch unless the majority of the room gets these test questions correct. But are we concerned about methane as a direct respiratory irritant? Is methane a problem for me with regard to my breathing? How many say yes, methane is a problem as it relates to breathing? That's why we're concerned about regulating it. Right? Right? Come on. Nobody? Okay, no, I don't say so. It's not. It's a little bit of a fallacy, actually, because you can breathe methane and it's not a respiratory irritant. Now, you wouldn't want to breathe too much methane for too long a period of time because there's other issues related to your health when it comes to breathing methane. So methane and VOCs are of concern. Primarily methane as a greenhouse gas. And so when you hear about air pollutants or emissions, if you want to sort of find truth, you have to ask yourself the same question that I ask people, which is, one, is it a direct respiratory irritant? Or two, are we worried about it as a greenhouse gas? Because if we're worried about it as a greenhouse gas, then we have to talk about its impact on climate change, weather change, and the resultant sort of environmental issues, and then health issues because of what's going on with climate change. So methane is not about causing asthmatics to trigger. It's not about people who are on oxygen who might have lung disease having their respiratory conditions worsen as a result of a direct effect of methane. It's this indirect effect. And as we talk about each of these things, I'm going to come back to that so that we all understand it. So again, this is about preventing methane from leaking so that we don't have this release of greenhouse gas. And as a result of the rulemaking and the cooperation amongst all of us for this, we are already seeing and anticipate continuing to see large amounts of reduction of methane as well as other VOCs or volatile organic compounds. So now I'm going to switch to ozone. We'll come back to methane in just a bit. But ozone, okay, same question. Well, actually, I'll ask you a first question for those who are old like me. Remember the days where we had the aerosol deodorants and hairsprays and stuff, and we were told, don't use that, we're making a big hole in the ozone layer out there. So when we're talking about ozone here, we're talking about that atmospheric ozone, right? How many say yes, of course, it's the same name? Oh, thank you, sir, for being brave. Most people think that that's what we're talking about, but unfortunately, scientists somewhere came up with the same name for two different types of ozone. We have atmospheric ozone, which is that ozone that we all learned about, that, we got to shift from spray cans to roll-ons or product or whatever it is, but that's not what we're talking about here. We're talking about ground level ozone, and ground level ozone is a pollutant, and it is a direct respiratory irritant. So ozone will, if you breathe ozone, cause you to have breathing problems. It will cause you to trigger your asthma if you have asthma, and things like that. And so there's a lot to do, a big to do about ozone these days, and the EPA rules and regs about ozone and attaining the appropriate level. So previously we were given this level of 75 parts per billion. And most of the state could attain that, and I'll show you that quickly in a second, except for the Front Range, where we were having trouble, and that's why we're called a non-attainment area. And so, yeah, we do have a higher prevalence of respiratory disease and conditions and triggers as a result of having that higher level. But we've been working toward getting that down, and it's a multi-year process toward doing that, but we missed our deadline. And so now we went from sort of kind of mild non-attainment to moderate non-attainment, but because we just missed the deadline. And not only that, what's confusing is the EPA has now since come out and said, oh, we've changed it. It's no longer 75, it's now 70. And so that's why now we're working kind of simultaneously on two different plans. But all that being said, we're in the process of still addressing the 75 before we even get around to addressing the 70. So it's confusing to folks because people are kind of like up in arms about like, well, what are we doing, where are we going? And I'm a Packers fan, by the way. Sorry, I have to out that at least once during any talk I give. But who doesn't like Aaron Rodgers, and who doesn't like the fact that Aaron Rodgers said, relax, okay? So as it relates to ozone, I just want people to relax a little bit because we have a little bit of time. If you're colorblind like me, you look at a chart like this and you say, great, everybody's in attainment. But for those of you who aren't colorblind and can see the colors, not everybody is necessarily or has been in attainment at the 75 part per billion standard, although here on the West Slope, we look pretty good. And I show you this very confusing and awful slide to show you again right before lunch, because just to give you a sense of the timeline, this is as it relates to that old standard of 75. This started back in, actually 2008, but we got going in 2012, and it's not going to be till 2018 till we're expected to become in attainment, just as it relates to the 75, let alone what we have to get pushed out to get to the 70. And so I don't have time to kind of give you all of this about the 70 other than to say that, again, this pushes things out to even the year 2023 before we have to address this. Why do we have to address it? Again, truth. This is a health determined level. We have to try to get below that 70 because people are having direct respiratory effects as a result of an ozone level above 70. So what does that do to my color-coded map? It does kind of keep the Front Range potentially in non-attainment, and it brings in Rangeley. But not through any fault of Rangeley when we talk about that particular area. That's because of our friends in Utah who have, the misfortune of having things kind of drift this way. And speaking of drift, we in Colorado, unfortunately, have higher levels of ozone than folks back east, for example, because we are the receiver of transported ozone from other parts of the country and other parts of the world, likes our topography and kind of sits here and gives us a little bit higher level. And also because of altitude, abundant sunshine, snow, that actually all contributes to ground level ozone. So does that give us a pass as it relates to then saying, well, we get to then have a higher level? Not really, but we're asking the EPA for some considerations as a result of this higher level of background ozone that we in Colorado have to have. So all that being said, this is the relax part as it relates to the 75. This is just West Slope sites, and if you go to the last column, which is the average of the last 3 years, you can see we're below 70. I mean, let alone 75, but we're below 70 for all of the sites, except, like I said, for Rangeley, which has been slowly coming down, 74, now 73. And so if we continue to work with our friends to the west, then we have, like I said, a fair amount of time to be able to think that we can comply with some work, but we think we'll be able to comply statewide with that 70 come 2023. So again, just as a review, methane, no real health effects from low-level exposures, no direct effect. Particulate matter, we're not going to talk about. The old days of the brown cloud, the particulates that kind of get suspended in air pollution, those definitely cause issues, but we don't have to talk about that or any issues related to that because enough work has been done in that particular area. And then ozone, like I already mentioned. So it's hard to do these studies because you're not going to stick people in front of an oil well or a natural gas well and tell them to breathe it for long periods of time and see what kind of things come up as a result of it. So what we know about health generally relates to modeling or what we call epidemiologic studies, some of which I know you folks have all seen that get published from time to time, where people try to relate things like birth defects or cancer rates being higher for folks living in proximity to oil and gas operations. And that's where we sometimes or often have to come out and say, hey, this is how you should be interpreting this data, because just because it's published somewhere or just because somebody with an MD or PhD behind their name says it's so, doesn't necessarily mean that we would agree that it's so. So, you know, the example was the birth defect study of a year or two ago out of the University of Colorado. Sure, it gives us something to think about, something to make sure that we're monitoring and that we're surveilling to make sure that there is no increase in certain types of birth defects as a result of living in proximity to oil and gas operations. But at the same time, we have to look at limitations as it relates to those kind of studies. And so I point out for that particular study, many of the wells that were used as part of that study were wells that had been shut in. So they weren't even active well sites. The data that they used to try and sort of track the women who delivered these babies was related to the hospital that the deliveries occurred at. Well, we know in rural areas where you deliver your baby is not necessarily where you live. So to make this assumption that you live where you deliver and therefore now we're going to extend that to say you have a higher risk of birth defects didn't make sense to us, and we needed to, you know, we felt the need to make sure that we let folks know what some of those limitations were. So sure, there is probably a slightly elevated cancer risk as it relates to being in some proximity, but we don't know what that proximity is because, again, we lack these human health risk assessments to be able to make any kind of definitive statements about that. So what are we doing then looking forward in my last 2 minutes? One, like I said, we're trying to address these ozone standards because we are worried about the health of the folks that live here, and we know that at levels of 70 to 75, that's outside of the health range, and that people are suffering as a result of that. So we want to continue to work on that. We know that the feds are proposing methane rules, and the BLM is looking at flaring and venting, and we want Colorado to be a model. We don't want duplication. We don't want operators to feel burdened because there's two different or conflicting sets of criteria that have to be met. So we're working to try and get that harmonization, and so far things are going pretty well. We'll hope that they'll continue to go that way. And then, like I said, this whole separate issue of greenhouse gas emissions, I won't talk about the Clean Power Plan because I'm not funded to do so, so I'd have to check out and then check back in again. But you know, suffice it to say, carbon is a greenhouse gas. So when we talk about power plants and having cleaner power, it's as a result of trying to reduce that carbon emission. So again, we reduce a greenhouse gas, not something that's a direct respiratory irritant. So we'll continue to have a Colorado-specific approach to greenhouse gases and respiratory irritants. So this is how I'll finish, which is just the list of studies that you should be sort of alerted to and on the lookout for. So both Garfield County and the North Front Range have been involved in collaborating with CSU to kind of get an inventory of what's being emitted in the air. And for the first time, it's going to be specific to oil and gas operations, because in the past, we have these ambient air monitors. You know, they're air monitors that are set up, you know, and they detect levels of pollutants for the entire area, but you can't really attribute what that air pollution inventory is to, whereas in these particular studies, we'll be able to see what's actually attributable to oil and gas operations. And those studies should be coming out sometime this summer. And I want to tip a hat to Garfield County, who has had to raise the money and do this themselves because the legislature or whomever was a little short-sighted in prior years to get that funding. And folks like Kirby and the county commissioners and the health department have been doing a lot of work to gather this information without the necessary state support that the Front Range has been able to get. The good news is, once those studies are done, we take that information and now we're going to do the health risk assessment. We're going to see, based on those inventories, what's the risk to our health and what does it look like. And those studies, or that study, again with CSU, both for Garfield County as well as the Front Range, has gotten state funding from the legislature, and so we'll be able to get a lot of really good information from that. We have our infrared camera study. So the infrared, the IR cameras, how many of you are familiar with the IR cameras? Okay, so you know that when you use an IR camera, it tells you very explicitly that that's methane leaking from your operation, right? How many say yes? You guys are way too smart. No, it does not. Okay, it just tells you that there's an emission. It doesn't necessarily tell you what's being emitted, and so we have to be careful on how those results get interpreted as well. It could be steam. It could be, you know, who knows what, but you can't necessarily, depending on, again, the majority of the IR cameras that are in use, delineate what the emission is, just that there is a leak or an emission occurring. Then we have the Frappe Study. It's not about milkshakes. It's funded nationally, as well as the NASA Discover AQ. And we had these planes flying over the Front Range this summer doing atmospheric detection of the different pollutants and the different levels of pollutants in the atmosphere from ground all the way up. So we'll get a lot of information as a result of those studies. The national folks kind of want it for their own purposes, but we've been after them and I think we've raised the money to go ahead and do Colorado-specific analysis that we'd be interested in, which again looks at all sources of emissions. And then, oh, by the way, CU has a 5-year, $12 million study going on right now, looking specifically at oil and gas and the potential health effects. And so we're trying to keep tabs and monitor that as well. So I've already talked about the risk assessment, and with that, I think we have about 5 minutes for questions for any of us before lunch is served.
Hey, thank you, Doctor. Former Representative Ken Summers actually served as the chair of the Health and Environment Committee before you took over the department. So certainly an area of interest for me. There was about like 3 questions or 3 thoughts that maybe you could respond to. With the change from 75 parts per billion to 70 parts per billion, what is the research documentation of the fact that health effects are significantly reduced in those categories, especially since 75 parts per billion was established in 2008, and all of a sudden it was changed in a relatively short period of time. Number 2, I guess, is the I remember seeing a report or a chart from, I thought it was the Department of CDPHE, and I assume it wasn't some of these aberrant MD CDPHE or whatever, that basically showed was a survey of those major health outcomes, respiratory issues, birth rates. There were about 6 categories, and it showed state averages in some of the key counties, and basically showed Weld County, which has our highest production of oil and gas, there indicated that their health effects impacts weren't really any different than many areas of the state, including the city of Denver, and just so just I guess if you could kind of just respond to some of the rationale for some of those measures, if it exists, and how do we determine to what extent we are successful, especially in relationship to the fact that it seems like Colorado consistently scores as one of the healthiest states in the country.
Well, thanks. The 75 to the 70, we're still working on our state-specific validation of that. Like I said, we're smack in the middle of just trying to comply and come up with the plan for the 75. So it's not that we're ignoring the 70. We're giving our feedback to the EPA on the 70, but we're kind of hard at work at the 75. But I can tell you, as part of our work, as we look toward getting to the 70, is what are we talking about as far as the health effect difference between 75 and 70? There's no cost-benefit analysis in this particular piece when it comes from the EPA when they made that decision. So, it's going to be interesting for us to see, are we talking about 5 fewer people affected? Are we talking about 500 fewer people affected? That's yet to come, but that's part of our analysis. I agree with you, and I probably, because I raced through it, didn't give it enough emphasis. I'm a bottom line end results kind of guy, and so we do all this surveillance when it comes to our cancer registry, our birth defects registry, our death registry, and so if we see a blip there, then obviously we're going to go out and we're going to investigate that blip. And there are no blips as it relates to these communities, whether it's Weld County or whether it's Garfield County. Some of you may recall, I guess it was a year ago or so, there was, again, a question of potential birth defects in Garfield County through prenatal ultrasound diagnoses. And so, we came out and we investigated because it was a called-in blip, not a blip that we had observed, and said, we found no evidence of any such blip and found other reasons why that was occurring. So the only thing I'll say again is that when you look at the overall data, there's a very, very, very slight increased cancer risk as it relates to some of the oil and gas communities. But again, it's along the magnitude of like 1 to 2 cases per 100,000. Now, if you're dealing with, and this is where you have to be careful when you interpret data, because if the baseline is 3 cases of pancreatic cancer per 100,000, but now in Garfield County it's 4 cases per 100,000, somebody could then say, well, that's a 25% increased risk in pancreatic cancer as a result of living in Garfield County. That wouldn't be an incorrect statement, but you have to peel the layer of the onion back and say, wait, that's going from 3 cases per 100,000 to 4 cases per 100,000. Is that attributable to oil and gas, or is that attributable to something else? Maybe there's a family that moved here that has a genetic predisposition for that, whatever it is. So we can't ignore that there is, again, this very slight risk, but we're still evaluating, and it's, again, nothing to kind of be alarmed about in any way, shape, or form. Yes, ma'am. Oh, sir.
Yeah, thank you. I want to thank the panel for coming today. We really appreciate it. And Dr. Wolk, it's a pleasure to see you again, sir. As you know, on April 27th, next Wednesday at the Moffat County High School in Craig, Colorado from 6 to 9, part of your staff will be there to address the audience. And and for the community and for those attending, we invite you guys to come in and participate in that. You spoke earlier in your introduction about the word truth. Just so you know, when you come to Craig, Colorado, you will hear the truth. And the truth of the matter of the fact is that our community is very passionate and protective and they want to continue to preserve what we have in relationship to the environment, jobs in the economy, and our quality way of life. And so with that, and I also, as I had addressed you earlier, I think about 3 months ago, we'd really love to have you up there so you could tour the power plant and one of our coal mines. So if that works out and you can come along on the 27th, that'd be great. Otherwise, we need to plan a date that is going to be convenient for you. Thank you, sir.
No, I appreciate that. And, you know, I'm sensitive to when people use health or environment as an argument one way or the other, but I'm certainly sensitive to the economic impacts of these decisions as well. And that's why for that particular meeting, we wanted to make sure that folks from the Office of Economic Development were invited to participate. Department of Local Affairs. I see my cabinet mate sitting right behind there. For those who haven't met, General Irv Holter, who's a great advocate for the communities and evaluating, you know, what the economic impacts of some of these health and environmental related decisions are. So, thank you. Yes, sir.
I want to thank you all too for your input today. I'm intrigued by the limited data on close proximity. Oil field workers from roustabouts to roughnecks have got to be in that close proximity. Is there any studies that it doesn't sound like there's been any done? Is there any thought about doing something along those lines?
Not through our department. I know OSHA and some of the other federal agencies are interested in that and have been studying that. And like I said, you know, before, you know, nobody thinks these are benign, you know, fuels. It's all a question of exposure, and it's all about exposure. And when I had the opportunity to come to talk to the Oil and Gas Task Force, I brought sort of this display of all these different items to try and get the point across how important exposure is, because, you know, drinking a liter of motor oil versus living, you know, 500 feet away from an oil and gas well are two completely, obviously different exposure experiences. But you know, people tend to lump those two experiences together.
Hi, Dr. Wolk. Thank you for joining us today and the other panel members. I had a question about the Frappe study. I won't try to say what the acronym is. But you said you're doing that over the metropolitan area, so you're going to get the different levels of what's in the atmosphere there. Are you then going to be able to compare that to, say, some of our rural communities and maybe some of our wilderness areas so that you kind of have a baseline to compare that against? Or if so, great, but if not, what do you anticipate finding from just doing it over the metro area?
So it's not our study. You know, it's national atmospheric blah, blah, blah. Yeah. But so what we're trying to do is kind of horn in and get their data so we can learn more about the Front Range. My understanding is they only flew their planes over the Front Range. And oh, by the way, we want to make sure that we're looking at, you know, specifically what days those were. Were they high pollution days? Were there any wildfires occurring at the time? And so there's a lot, again, that we have to sort of discern. So I haven't heard anybody talk about the comparison then to what it means to the rest of the state. If I find out, I will definitely let you know. But my understanding is it's really us trying to horn in and get access to the data. We have to use our own money to do that and see what then, you know, we can learn as it relates to at least the Front Range.